Hi everybody, Dr. Baumholtz Plastic Surgery, and on today's episode I want to talk about managing expectations. You'll forgive me, I'm in my Sunday attire. I'm here in the office today. I've got my two furry helpers that are wandering the office. I'll have to round them up in a minute. But anyway, I wanted to spend a few minutes talking to you today about a question that I get asked a lot. And the question goes something like this. What's the most common thing that I do as a plastic surgeon? And I get asked by medical students, I get asked by people in social gatherings, and I know that they're looking for an answer along the lines of boobs or belly or liposuction or rhinoplasty, trying to pigeonhole me in terms of what I do for a living. But I can tell you that the number one thing that I do as a plastic surgeon, and many plastic surgeons do or should do, is manage expectations. And what does that mean? People come to plastic surgeons with an idea in their head as to what they want to look like. And either it's a more youthful version of themselves, or sometimes they either have an ideal that's unrealistic, or they have a movie star or actress or something they've seen online or in a magazine, and they want to look like that. And the great majority of the conversation in those scenarios has to do with helping people identify what their I'll show you him in just a second, what their anatomy is, and whether or not their expectations about what they want is realistic. And oftentimes, I hate to say it, my helper just bumped the stand. Oftentimes it's not, and so my role is to teach people about themselves and about the things that they want. Someone commented on Facebook the other day, and they said that they thought that our breast augmentation special was ridiculous or something to that effect, and that people should just be happy the way they are. And I want to say, as a plastic surgeon, I tell all my patients I think they're beautiful just the way they are. That said, if there's something they're unhappy about, and this is where, as a plastic surgeon, you can go from the reconstructive aspect to the aesthetic aspect. If there's something they're unhappy about, can they put into words what it is that they're unhappy about? And then can I put into a surgery a solution? So oftentimes people can say, I don't like this or that. And my job is to say, okay, can I pick up a scalpel or some other technique and do something that's going to get them closer to what their goal is? And oftentimes I'll phrase it just like that. I'll say, I'm going to get you closer. I'm going to make you a better version of you, but I can't make you someone else. I will often make the joke that when a massively overweight patient brings me a picture of J-Lo's backside and says, I want to look like that, I say, nay, I'm a plastic surgeon, not a magician. And while it's tongue-in-cheek, I do it in a way to try to make a connection to that patient. But I also try to get across the very real message, which is that, the good Lord or Mother Nature gave you an anatomic frame. And your life choices or dietary choices have led you to this point in life. And there are certain things that we can do to make it better, and there are certain things we can't. I'm often frustrated when other practitioners, not necessarily plastic surgeons, but other practitioners will tell a patient, oh, you're going to love it and it's going to be great and there's no such thing as risk or complication. That's nonsense. These are real operations, and there's no such thing as an operation without some degree of risk. And in a recent post, we mentioned that you should be aware of who's doing your surgery. I think we did a very good job in recent memory of getting patients to ask, is your surgeon board certified? Now we have to go a step further and have patients ask, what are you board certified in? Because they say you're board certified, and the person's like, yeah, I'm board certified, but it happens to be, family practice or dermatology or something, and not throwing shade on those specialties. God bless, there's a point and a place for them. But when it comes to aesthetic surgery, I and many others believe that you should go to someone that is trained and certified to do this work, specifically by the American Board of Plastic Surgery. If you're visiting with a facial plastic surgeon, that's often an ENT, That's what that designation of facial plastic surgeon means. And that's all right, that's great. You know, if you're doing something, you know, face related and they're a facial plastic surgeon, and they're board certified in the appropriate specialty, that's great. Beware of people that are claiming to be board certified in cosmetic surgery. You know, the Texas State Medical Board recognizes a group that calls themselves the American Board of Cosmetic Surgery. Their training is not the same as what we go through in plastic surgery. And I'm sure there'll be some that will respond to this video, and I invite that. I like dialogue. I'm not throwing shade, but I do think the phrase caveat emptor, or buyer beware, applies today more than ever, especially as more and more physicians and even non-physicians try to enter the aesthetic marketplace. That doesn't mean that there's not room for other specialties. There certainly is, but I really think that the important questions are, you know, how long have you been doing this? How many of these have you done? What's your plan to manage a complication? I mean, it's great if everything goes great, but, you know, if something bad happens, God forbid, what's their plan and what's their background and training in managing that? You know, one of the benefits, for good, bad, or indifferent, of being a board-certified plastic surgeon, there's very little that by the time we get to you that we haven't seen. Now, it's a discipline of tools. So even though there are some surgeries that I have done, and I will admit that, you know, I may never have seen this in training, and I trained for 9 years in 3 different specialties. I may never have seen this particular aspect. I guarantee you I have taken that surgery apart into its component pieces, and all of those pieces I have done iterations of hundreds of times, as do many of my colleagues in this business. All right, so back to my initial proposition or thesis of the video, which is managing expectations. We ask all of our patients to go online and get pictures from the internet of a look they're trying to achieve, because that really helps me understand how realistic they are in what they see and what they want to see. We then use that as a jumping off point to have a discussion about what they can and sometimes can't have. And I try to be as honest as I can be, and when I say to someone, you know, that's great, but you can't have that. And you can't have that because you're not that tall, or you're not that skinny, or you're not that, whatever it might be. I think it's important to be honest. I've had patients walk out. I've had patients choose other surgeons. I'm okay with that. I will tongue-in-cheek say, that's great, I'll fix them when they come back, but nevertheless, I'm okay with that, because I would much rather someone have a realistic expectation about what's to come, what I can deliver, what can be delivered in surgery, and then what I can deliver, and then what their outcomes will be. And I think if you approach your surgery with realistic expectations, you are going to be a rock star patient. All right, well, that's it from this Sunday. My 2 furry assistants seem to have fallen asleep somewhere else. I'll have to show you a video of them later. Anyway, be well, and I look forward to seeing you here at Baumholtz Plastic Surgery. Bye.